Nice meeting you. I'm Taek Kyun Kim from South Korea. Nowadays we use hashtag when we talk about some topics. So to make it summarize, I will talk about the idea, beautiful nose. To do that, to know the history will be overlooked, and usually the patient is from Asia, so Asian. Rhinoplasty means nose surgery, and I'm gonna talk about current trend in Korea as well. First of all, we have to define which is the what is the beautiful nose. But the beauty, the criteria is quite subjective. So it is quite difficult to define one idea or a beautiful nose. Various factors affecting on the criteria, such as gender, like male and female, and race, like the Caucasian, Asian, and trend. Even in Korea, the trend is moving. Many things affect about the idea and beautiful nose criteria. And this is from the article, shows different races having a different idea or beautiful nose. This shows the American Hollywood stars nose in 1930s on the top and left side, and the right side is 2010 Hollywood star. It is looks similar, but still there is some change. And this is Korean old picture, and in the middle is 1970s movie star, and the right side is 2000 famous movie stars. As you see, they have different facial shape, also different nasal shape. So if you are thinking about your nose shape, then you have to think about that. Oh, like you have to think about your facial shape, and for the harmony with the face, the nose should be something like that. When you really wanna having the nose surgery, then you have to think about that first. So we will briefly take a look at the development of history. The beginning of nose surgery is from the reconstruction, not cosmetic purpose. But after the World War, and because of some trauma and some problem on nose, so people just trying to fix it. And from the 1930 or 1940s, because people had a technique about the nose surgery, so they take on the cosmetic from the reconstruction. So the recent cosmetic rhinoplasty, which is nose surgery, start from the 1980s in Korea. As you see here, the beginning of the implant, we use the L shape like this implant, but nowadays it is changed to I shape, which is called box shape. And 30 years ago, we only used silicone implant, and but we didn't use poly. But nowadays it is changing, so now we use the poly for the tip and silicone implant for the dorsum usually. So when I do the consultation with the patient, we have to understand each other more than 90%. To do that one, and I show this profile, and they will pick up. And also personally, I think the nasal tip is more important because the tip moves three-dimensional, like forward, backward, and longer, shorter, and the thin of the tip is thicker, so there is more limitation compared with the dorsal skin. So we do the tip first, and if we make a beautiful tip, then the dorsum can be only doing the supportive function. There are many things also for the dorsum, also having manufacturers like picture, and as you see here, many things that we have to consider. First one is height, and second one is width. So it is made by usually by silicone implant. Usually for the nose, usually focus on the height, which is the thickness of the implant. Let me show you. As you see here, the implant like this. This is height. When I put the implant here, the thickness will be the height. Thickness will be the height from the letter. Usually people only think about it, but when we put this here, but the width is also affected. As I said, from the front, we have to think about height and width. So when we choose the implant, we have to think about the width as well. If I have a chance to present about breast surgery, I'm gonna talk about breast implant as well. The breast implant, the width is more important. The height is second choice. But for the nasal implant, the height is first choice and the width is second choice. So there is something in common, but the priority is different for the different part of implant. When we talk about the nasal bridge, there is two important things: the height and width. But considering about the tip, we have to think more things to consider. As I said, just is compare with the facial bone surgery. When I do the jaw surgery, I do trim first, and then doing the angle area second. Just like rhinoplasty, doing the tip first, and then those are nasal bridge second. Because nasal tip, and the zenio, the chin point, moves to three-dimensional. And if once it is decided, settle down for the beautiful shape and position, then we can supportively cut the bone, or we can supportively insert the implant. There are many things to consider when we talk about the nasal tip. When you take a look at from the side, we have to, when we do decide the nose surgery, then we have to think about the forehead and nose and lip and chin, because Even when you take a look at three pictures on left side with the same nose, the chin point is different. I mean, the chin left side is small chin, in the middle is normal, and the right side is big chin. And even with the same nose, looks different. And also, we think about the columella, which is in the middle, this one, and also the both sides ala. Because when you take a look at, sometimes this harmony can make nasal shape not really good. Because even the tip and dorsal line is good, but the ala and columella relationship is not beautiful, then it also affects the total shape of nose. Also, when you take a look at the nose from the bottom, then it should be usually similar, and there is good proportion. Like, so we have to think about the visual view as well when we talk about the nose surgery. We talk about the shape of the nasal tip and dosum, but guys, there is another thing that we have to think about because nose is prominent structure on face. So always there is mechanical stimulation from the outside, and also we just touch and move a lot. So it should be movable and it should be stable from the external fold. A recent trend in Korea, usually like 10 years ago, the patient only usually satisfied with only the shape. But nowadays, people want to having the movable tip as well with a beautiful shape. As I said, in conclusion, I think tip is more important and more things to consider compared with the dosum. But dosum is also important. Now, I will talk about the rhinoplasty. The primary one means first surgery, and from the outside there is four things the surgical plan. First one is a plasty, using the cartilage of the patient's own, and the second one there is a bridge, usually by silicone implant. Third one is nasal bone. If the patient having the wide nasal bony bone, then we think about narrowing of the nasal bone. First one is the elevate. If it's too wide, then we can make it narrow. And from the outside it's full, but inside there is the nose is also the breathing respiratory organ. So we have to think about the function of nasal breathing. So if there is some discomfort during the nasal breathing, then we have to think about the surgery to correct the nasal problem. And if it is secondary, which means not first time surgery, then we have to use another materials for the tip and dorsal area. The first one on the right side is the lip cartilage from the patient. Second one is the dermal fat graft from the buttock area, and third one is from the temporal fascia, and fourth one is the dermal graft from the groin area to cover the silicone implant. Because secondary case having some problems inside the cartilage framework or the skin problem addressed. So like individualized application of various kind of cartilage and other materials from the patient own or the synthetic material. As you see, many steps, but usually for primary case, 1.5 hours. Among them, 1 hour is dedicated for the tip, and 30 minutes is dedicated for the dorsal area. So the time duration of operation is also shows tip is more important. And the next slide shows, as I said, like 10 years ago, the surgical procedure made a tip more stiff, but beautiful shape, but stiff tip. But now it's changing, so we divide like the dorsal area and the tip area. So there is some buffering, and the tip is more movable nowadays. Until now, we talk about the current technique of surgery, but the technique is getting better based on future techniques such as CT scan and 3D printing based on the CT scan. So nowadays, there is a new implant. I mean, the implant silicone is the same, but the manufacturing method is different. For the individualized, if the patient took the CT scan and the data is going to the company, and the company makes individualized silicone implant, and much better. I mean, the much fitting implant can be produced only for that patient. Also, for the young surgeon, the CT scan based on the CT scan can make a model, and we can do the simulation surgery before real surgery. It is also used for the training of the doctors. And also, even the technique is trying to make a biologic implant, not silicone, such as synthetic material. They just want to make a synthetic scaffold, and then they have a technique to make the cell growing up on the scaffold. And after culturing, then they use that bio implant can be used. So in conclusion, what I want to talk about is there is no one beautiful nose. You think some actresses' nose is really beautiful. If you have the same nose, it will be beautiful, but it's really different because the face is different and the structures are different. So when you think about you want to correct your nose by rhinoplasty, then you have to think about your facial harmony. So then you have to think about another things like you have to think about the forehead and you have to think about the chin and also from the lateral and also from the front. Then you have to think about any other facial features. Plastic. Then you have to think about your facial harmony. Do not stick on one type of nose.
เป็นแผล
And thank you for listening. And if you have any question, you can send me by direct mail, direct DM. Let's move on to the quiz. And I'm gonna get the answer from the patient.
She asked
Yes, question.
she has to do nose surgery one time and used by silicone and then now she got a keloid. She wanna know is will dangerous or she have to fix this.
Which here or inside?
Oh, inside.
Inside. But is it visible through the outside or you only you feel inside with the fingers or
Oh, it's not visible, not hurt.
not visible? Okay. But the keloid or scar, hypertrophic scar is not harmful by itself, but you think it is annoying to you, then I think easily we can excise easily, but there is some chance of recur left. We have to use the injection of the anti-keloid or anti-scar injection and also recommend the medication for anti-scar. But sometimes there is some reason make the scar just like can you see if this is the skin. So if we open up and the implant is inside and it is continuously stimulate inside, so that makes a hypertrophic scar. In that case, we have to think about the revisional rhinoplasty to remove the cause of that scar. Sometimes it is happening. Okay, another question.
She says is you always think about natural and safe or make nose.
Yeah, usually I recommend natural shape because if it's too high or too projected, usually the skin cannot endure. So there is some problem happening in after 1 year or several years later. That's why I always recommend the natural. But if the patient really wants, in spite of the risk, then I can do that for the patient. But usually I persuade to stay in a safe side. And if there is no more questions, just move to the quiz.
How about this one? Facial bone,
Oh, I
eyes.
think it is. Tida is correct.
Okay.
Woo! Man,
พี่ธิ
good.
ดา
Yeah, correct answer. Eye surgery with a non-incisional method and revisional rhinoplasty and the facial bone contouring surgery with the background. Oh, any other question? No? No more.
มีคำถามอีกไหม
Thank you. Kakunka.
ขอบคุณค่ะ
Yeah. See you next time.
โอเคสำหรับวัน
See
นี้
you.
คนชั่วโมงครึ่งแล้ว see you next Saturday
Yeah.
see you next Saturday นะคะบ๊ายบาย